So your name?
Sure, Martin Williams, Dr. Martin Williams, and I'm the Executive Director of PRISM, Psychedelic Research in Science and Medicine. I'm also a senior postdoctoral researcher at Swinburne University in the Centre for Mental Health. And I'm really quite involved now in several clinical trials of psychedelic-assisted therapy. I was involved in setting up the original St. Vincent's study at St. Vincent's Hospital, Melbourne. And certainly have another bunch of things.
That's amazing. How do you see psychedelic-assisted therapy in like 10 to 20 years, like as it starts to integrate with our society and things like that?
Yeah. Well, I certainly see psychedelic-assisted therapy gaining quite a lot more prominence as an intervention, as an approach to mental health intervention. I don't think it'll be the one and only by any means. And although there are certainly shortcomings associated with current approaches in mental health treatment, I do believe that for quite a number of people, they still are about the best we have at the moment, and that psychedelic-assisted therapies won't be for everybody by any means. But that said, it does appear that in certain people there are going to be some dramatic improvements in their condition, their mental health condition. And in fact, another aspect that I spoke about in this talk was the potential for the betterment of people who otherwise have quite good mental health. In other words, it may generally improve their outlook. It might increase their attention span. It might broaden their perspectives. A number of things which we feel could be quite positive in terms of improving people's quality of life even further than it is already.
I heard that, and the term you called for it was betterment of well people.
That term is actually was originally coined by Bob Jesse, who was one of the main sort of instigators of the original Johns Hopkins University research into psilocybin in healthy volunteers.
Right. So like one of the originals.
Yeah. So they started that in about 2002, and they were communicating those results in 2006. In fact, Bob Jesse was one of our international guests and speakers at Entheogenesis Australis, the EGA conference back in 2007, I believe.
What do you think the general public needs to know as it stands right now about psychedelic-assisted therapy?
Well, certainly psychedelic-assisted therapy shows great promise for the treatment of certain mental health conditions, but it also carries some risks, of course. And it's important for people to maintain a realistic perspective, I guess, on things. So there's quite a lot of hype. There's maybe a little bit of evangelism that's been emerging over a period of time in relation.
Could you talk about that a little bit?
I could. Certainly, one aspect of psychedelics, just in terms of their effects on people's way of being, is that they can really generate a lot of excitement and a little bit of zeal. Sorry, I've grabbed your hair. So they can certainly elicit a lot of enthusiasm and zeal, which in many ways is great. I referred to that sort of playfulness which can follow psychedelic experiences, and that's a wonderful thing. But if it's carried too far, I think it's possible for people to become a little overexcited, a little over enthusiastic about the potential for psychedelics to treat, for example, all ills. So we're very careful to make it clear that nobody in our field really believes that psychedelics will be a panacea for all ills, and that it's important to keep these sorts of things in perspective. Now, we've seen that sort of play out, I guess, in recent times in terms of the enthusiasm with which psychedelic-assisted therapies have been promoted by certain groups and organisations in their fields. We feel that a lot of that enthusiasm, while it's laudable and exciting and promising, still might be a little bit excessive in some cases, and that I think, we really feel that it's important to take a more measured approach, particularly because people's lives are at stake. And of course, one of the arguments for psychedelic therapies is that people are already doing it pretty tough, and so this may well offer a solution for some people who are really suffering intractable mental ill health. But nonetheless, we need to be careful because mistakes have been made in the past, and we don't really want to see the same mistakes or similar mistakes.
Do you have anything else you would like to say for the video or anything like that? And
Well, I think one thing I would like to say as somebody who's been involved with a non-profit organisation for a while, which is PRISM, it's really excellent to see APS involved as it is in this conversation, and I think we're all able to contribute in our own way with our own perspectives to the overall sort of global discussion around drugs, about drug decriminalisation, around applications of psychedelics in particular for mental health. And so we're all, I think, heading in the same direction, and it's really fantastic to be working with you guys on that as well.
Awesome. Thank you so much.